This video shows uterine polyp with an interior wall fibroid, the overgrowth of cells in the lining of the uterus. Endometrium leads to the formation of uterine polyps, also known as endometrial polyps. Uterine polyps are more likely to develop in women who are between 40 and 50 years old than in younger women. Uterine polyps can occur after menopause but rarely occur in women under 20 years old. Around 5% of uterine polyps are cancerous or precancerous. Uterine polyps range in size from a few millimeters, no larger than a sesame seed, to several centimeters, golf ball size or larger. They attach to the uterine wall by a large base or a thin stalk. You can have one or many uterine polyps. Signs and symptoms of uterine polyps include irregular menstruation, bleeding, for example, having frequent, unpredictable periods of variable length and heaviness, bleeding between menstruation periods, excessively heavy menstruation period, vaginal bleeding after menopause, infertility. Cause of uterine polyps. Each month estrogen level in women rise and fall, causing the lining of the uterus to thicken and then shed during your period. Polyps form when too much of that lining grows. That may be due to the changes in estrogen level that happen just before and during menopause. Treatment may not be necessary if the polyps do not cause any symptoms. However, polyps should be treated if they polyps might. The overgrowth of cells in the lining of the uterus leads to formation of uterine polyps, also known as endometrial polyps. These polyps are usually non-cancerous, benign, although some can be cancerous or can eventually turn into cancer. Precancerous polyps. Approximately half of women with uterine polyps have irregular periods. Other symptoms include prolonged or excessive menstruation, bleeding, menorrhagia, bleeding between periods, and bleeding after menopause or sexual intercourse. Uterine polyps are the cause of abnormal bleeding in about 25% of these cases. Uterine